Most people, when they think about dementia prevention, they might think about crossword puzzles or maybe a supplement or eating better, exercising more. And yes, those do matter. But in my clinical practice, I often see people trying to do all the right things, but many risk factors just going right under their radar. So today I want to share with you five of these often overlooked risk factors for cognitive decline and what you can do about them. Hi there, Dr. Cindy Libert here, and welcome back to the Rethink Aging podcast. I'm so glad that you're here today. Today, I'm going to share with you some really important information that's near and dear to my heart. That's on the topic of dementia prevention and healthy aging. Most people, when they think about dementia prevention, they might think about crossword puzzles or maybe a supplement or eating better, exercising more. And yes, those do matter. But in my clinical practice, I often see people trying to do all the right things, but many risk factors just going right under their radar. So today I want to share with you five of these often overlooked risk factors for cognitive decline and what you can do about them. And stick around till the end. I bet at least one of these will surprise you. So let's dive in. Number one is get your hearing checked. Let's start with hearing. This one is huge. Hearing loss is one of the strongest modifiable risk factors for dementia that we know. Large studies have shown that untreated hearing loss may account for 8 to 9% of dementia risk worldwide. That's massive. So, why does hearing loss matter so much for the brain? Here's what happens when you can't hear clearly, your brain has to work overtime just to decode the sound. So, there's less energy available for your memory and thinking, and you start to often people will withdraw socially without even realizing it when they start to lose their hearing. The brain gets less stimulation, and certain regions of the brain literally begin to shrink. We know that from neuroimaging studies, there's accelerated atrophy in the temporal lobe in people with untreated hearing loss. That's the part of the brain involved in memory and language. So, treating hearing loss is not just about convenience or being able to hear, it's about brain preservation. So, I recommend for my patients to get an audiology baseline exam in midlife and then repeat that testing every year or two. And as soon as you find out you need hearing support, don't wait. These little tiny devices can be life-changing, and it's all about, not just hearing and staying engaged, but protecting your brain. The number 2 is to inspect your home environment. Your home should be a beautiful sanctuary for your health. But unfortunately, for many people, it is actually toxic. We have mold, volatile organic compounds, particulate air pollution, heavy metals, pesticides, water contaminants. And here's what I tell my patients. If you don't have good air quality or filters, air filters, water filters, then you are the filter. Your liver, your kidneys, your brain, your immune system have to work overtime to deal with the toxic burden. And all these factors drive neuroinflammation and premature uh, aging, accelerated aging. And it does that through oxidative stress, um, disruption of the blood-brain barrier, neuroinflammation. Again, all of these, contaminants that we can be exposed to have been linked to neurodegeneration. We know studies show that long-term exposure to air pollution causes accelerated aging and cognitive decline. So I recommend, if you can, do a professional environmental home inspection, use high quality air filters, water filters, and be very thoughtful about what you bring into the home in terms of cleaning products and fragrances. And of course, you want to address any water damage or mold, like primary care for your home. So, number three is don't ignore borderline blood pressure. Let's talk about blood pressure. Most people think, oh, it's just 137 over 89. It's not that bad. It's just borderline. But borderline for decades is not benign. Your brain depends on a healthy flow of blood and oxygen. Every neuron is supplied by these tiny blood vessels, and high blood pressure can damage the blood vessels. You can get microvascular disease, and that leads to white matter changes in the brain that we can see on MRI, and we often see it in people with cognitive decline. That means there's reduced oxygen delivery in the brain, and high blood pressure puts you at higher risk for stroke and heart attack and dementia. Studies show that midlife hypertension strongly predicts later life cognitive decline. And here's the key: the readings that we see in the office aren't always a good reflection of what your blood pressure actually is. So I use 24-hour ambulatory blood pressure monitoring in my practice to look for blood pressure spikes, or just loss of that normal dipping pattern that we see as hypertension begins to develop, or just frankly undetected hypertension. So it's so key to know your blood pressure and address even subtle elevations. Of course, you want to do it through lifestyle medicine and functional medicine first, and then medication if needed. So, number four is to know your body composition, not just your weight. We're talking about muscle and fat. So, your bathroom scale is probably lying to you, especially as you age. It doesn't tell you what really matters. It matters how much muscle you have and how much, especially visceral fat, that you carry. This determines, in a large part, your metabolic health. So at our clinic, we use an in-body composition test that helps people to see clearly how much muscle mass they have and how much body fat. We know that low muscle mass, we call it sarcopenia, is associated with insulin resistance and inflammation and just overall premature aging and a higher dementia risk. So, when there's a combination of high body fat, especially that visceral fat around the middle, it's linked to metabolic syndrome. And that can lead to brain insulin resistance. We know that Alzheimer's disease is in large part related to insulin resistance in the brain. And so addressing body composition is so key. Um, I often, unfortunately, see sarcopenic obesity as people age. That's where you get loss of muscle mass with high body fat. So that is just detrimental to your metabolic health and blood sugar and your blood vessel health. Muscle is the organ of longevity. It supports our brain in so many different ways. So I want you to ask yourself, do you know what your muscle mass is, your body fat percentage, and do you have a plan to actively preserve your muscle mass as you age? That is so key as a part of any dementia prevention plan. So, number five, overlook factor, and this is often tender because many well meaning people are unintentionally harming their brains with common medication. So, it's to look over your medication list. Let's start with Benadryl. It's a common over the counter medication. It's a strong anticholinergic, which means it blocks acetylcholine. And acetylcholine is the primary neurotransmitter involved with memory. Long-term anticholinergic use has been associated with brain shrinkage or atrophy, and a higher dementia risk over time and cognitive impairment. So it's so key if you're using this to sleep or for other reasons to try to find an alternative. Um, we know, large studies show that long-term exposure to these anticholinergics do cause accelerated brain aging and shrinkage and put you at risk for dementia. So those products that have the PM on it, they probably have Benadryl in it. So you may want to to look through your over-the-counter medication list. And of course, many prescription drugs also carry a risk for increased cognitive decline and even shortened lifespan, especially those sleep medications, the sedative hypnotics. And I know that I'm always preaching about sleep and it matters so much for our brains, but drugged sleep is not restorative sleep. So I encourage you, review your medication list, talk to your doctor, say, find out if any of your medications are putting you at risk, especially those over the counter ones that you might not be telling your doctor about. So those are just my top 5 here that I'm sharing with you today. There's so many others. I encourage you to be proactive with your brain health. Your brain, your body, they need TLC. And, we have to be intentional about this as we age. So I wanted to share with you, this is my passion. This is what I love to do in the clinical setting at our medical practice here in Asheville, North Carolina. I've built these amazing programs for not only prevention, but also treatment of cognitive decline. So I encourage you to reach out, learn about our services. And if you're somewhere else in the US, I have created something called the Rethink Aging Community. And that's to give you access to this kind of information, but more in depth. Once a month, we meet for a live